Hi there, HS215217. This is a brief lecture on behavior therapy, which is far more complicated than what I'm going to talk about for the next 15 minutes, but I'll try to get to as much of it as I can. So I'm basically just giving you a basic 101 of what behavior therapy is, so you have a sense of what it is in our field. So behavioral approaches and treatment interventions. A behavioral approach is, quite frankly, literally just trying to change the behavior of your clients. And the assumption, of course, is that the environment determines the individual's behavior. So it is very much um, that we have control over our behavior and that there's environmental factors that cause it. So when you think about nature versus nurture, we're really talking about nurture and about how we can determine and control behavior of other people. And how an individual responds to a given situation is the result of past learning and usually behavior that has been reinforced in the past. So there's a really funny story about, I don't even remember which president it was, but one of them had a dog in the Oval Office, and apparently when the dog would start like chewing on the rug, he would give it a bone. And one of the people working for him was like, "You are training that dog to chew on the rug." So if you think about it, it makes sense, right? If you do a bad behavior and then you get a piece of candy, you're going to probably do that behavior again. So behavioral approaches are making sure that you reward good behavior and don't reward bad behavior. And if I was going to distill it into something really small, we'll talk more about it. So the big ones are Pavlov and what's the other one? Skinner. So we'll go to Pavlov first. So Pavlov is the one, I don't know if you guys learned about this in Psych 101, but with the dog salivating. So behavior theory, it's based on the belief that behavior is learned. We learn how to behave. And Pavlov came up with what is called classic conditioning. It is one type of behavioral therapy, and Ivan Pavlov is very famous because he used dogs and their learned responses. So he did a whole experiment with the bell. Ring the bell, the dog salivates because the bell means that there's food coming. And he paired the sound of a bell with the food. So that is actually also called chaining, which I'll get to in a later slide, but it's where you do where basically there's a bunch of different things that you chain together behaviorally. So Pavlov is the one that came up with that. You give someone like a signal that something's going to happen. And that's why the dog salivated, because every time it heard the bell, that meant the food was coming. So therefore it got hungry. So behavior modification is when we modify behavior. So with classical conditioning, the response is learned through repeated and immediate association. So the dog associated the bell with food. Behavioral therapies also can break the association. So like with phobias and whatnot, there's a lot of therapies that would try to break your, like if you have an association of like every time I eat, I smoke a cigarette. They would try to break that association. And a phobia too, like if you have a phobia of every time I see a spider, I scream, there you try to break that association as well. So things that therapists use for behavior modification: relaxation training, virtual reality exposure. That's newer, right? Virtual reality hasn't been around for very long, but they are using it for therapy now, where you would virtually expose someone to something that might bother them. So for instance, if someone was afraid of going on planes, they could have a virtual reality experience of going on planes to desensitize them. So exposure and response prevention techniques. Exposure therapy is the one a lot of people are aware of. That's the one where you literally expose people to things that are they have difficulty with or that bother them. So for instance, if you tell me I'm really afraid of going to the pizza shop and I wanted to do exposure therapy with you, I would say, okay, well, how about today we just talk about going to the pizza shop? And the next session, I would walk with you and get close to the pizza shop, and we would look and see, hey, it doesn't look that scary. And what do you think it would be like if we went in? And then we'd work towards the experience of going into the pizza shop to expose you to it. Another example is with a lot of war veterans, they've done exposure therapy, like Vietnam veterans. And what they would do is make them talk again and again and again and again about their experiences of being in war to the point where they became desensitized. So if they were talking about like bombshell, being in a war zone, they'd make them tell these traumatic stories again and again as a way of exposing them to see if their response became less and less hypervigilant. Social skills training, this is used a lot with kids and adults on the spectrum. That's also a behavior modification skill, so to speak. ABA, they do social skills training. Modeling, that is when you actually do rehearsals and homework. So behavioral rehearsal would be like if we said, okay, I'm going to go on a job interview and you would rehearse the interview with me, that kind of thing. Or modeling is when I model a behavior and then you model it back to me. Homework, a lot of behavioral therapists would do homework. So you'd actually have pieces of paper you have to fill out and whatnot. It can be very, depending on the kind of therapy. Applied behavioral analysis is something we've talked about in class, and two of the interns are doing that as their internship. But ABA is definitely 100% behavior modification. That is what ABA is all about. And that's for kids in the spectrum. They're trying to help them with their behavior. Aversion therapy, so that's kind of similar, actually, what I was talking about with the planes. Like aversion therapy, if you're averse to certain things, again, it would be more like exposing people to things that they have aversion towards. Flooding, that's another one actually where you actually I almost said overdose. Kind of. It's basically flooding is where you if I explain this correctly, where you would do something a lot, like you would keep talking about the thing that bothers you, and you would kind of flood that memory. So if I had like a traumatic incident that happened to me, flooding would be if I talk about it like ad nauseum. Systematic desensitization, similar. You also would be desensitizing yourself to a stimuli. I know I've probably mentioned EMDR before, but EMDR I always is eye movement desensitization and reprocessing. So EMDR would be a really good example of that. Token economy, they would also use that in ABA. It's where where basically that you would get a reward for good behavior. So if that was a sticker or a candy or whatever, that's a token economy, like some sort of reward for your good behavior. So the other big one is Skinner. Skinner and Pavlov are the two big ones. So he developed a behavioral therapy approach called Operant Conditioning. He believed in the power of rewards to increase the likelihood of behavior and punishments to decrease the occurrence of behavior. So he definitely was the one that kind of came up with positive reinforcement and negative reinforcement. I'm not going to go too much into this because I think this is also like a Psych 101 thing. But if you're interested in Skinner or Pavlov, I definitely recommend you read more about them. Look them up on Wikipedia. Check them out. They're very big in counseling and in the history of psychology, and certainly in CBT. They're like the grandfathers of this kind of stuff. So behavioral therapists work on changing unwanted and destructive behaviors through behavior modification techniques such as positive or negative reinforcement. So I'll give you some examples. One example I can do for myself. So when I was a kid, my dad, and when he was an undergrad, he took psychology, apparently. And he learned about positive reinforcement back then, which would have been, I guess, in the 70s or something. And he, when they were potty training me, they used M&Ms to get me to use the potty. So it was like, okay, if you use the potty, we'll give you M&Ms, and it worked. So then I was potty trained. But then this really horrible story came out of it, which is apparently my parents were having friends over. They were eating dinner. They're hanging out. And I'm like a toddler, I assume, like 2 or 3, however old I was when they potty trained me. And I just pulled out the potty right in front of all these people and did my business right in front of them because I wanted an M&M. So that's the back. That's when it, yeah. That's when it fires on you. But that's positive reinforcement. Negative reinforcement, I don't know if you guys ever have seen Ghostbusters, but when Bill Murray in the beginning is doing those tests and he like zaps people when they have the wrong response, even though he's not doing it correctly. But anyway, the negative reinforcement would be like if you hurt someone because they did the wrong thing or you yelled at someone, But also negative reinforcement would be taking away something. So a lot of people that I know with their kids, it's like, okay, you lose privileges if you do something wrong. like you lose your iPad or whatever. So, behavioral therapy for children. Talking about this because I know a lot of people in their internships work with children, and a lot of people that I teach are interested in working with children, which makes sense because when you're starting out in the field, you probably want to work with people younger than you, than older than you. So, ABA would be the probably most common form right now, at least, of behavior therapy for children. But there's definitely other. You could definitely do CBT with kids as well. So applied behavioral therapy and play therapy are both used with children. It's basically different methods, but the idea again is you're trying to reward positive behavior and punish negative behavior. Punish not like spanking, but punish as in take privileges away. So in ABA, a lot of times they will, have kids do something good, and then they will get a reward like get to watch a video or get to pick out a sticker or, some sort of prize, so to speak. And same thing, they get those things taken away if they don't do the right behavior. It definitely takes time for children to trust their counselor, and that's normal. And so in that case, you definitely need to build a relationship with children before they're really going to maybe totally be cool with the whole system. But basically, behaviorism is not always the most empathetic form of therapy. It's not talk therapy. It's not like really deep getting to know you, feeling sympathetic. It's more about how do I change your behavior. So behavior therapy is definitely going to be used with kids that have behavior issues, that have ADHD, who are on the spectrum, because a lot of kids on the spectrum typically do have behavior issues. So that's why we use it when children. You're not going to use it for a kid who's like parent just died, because they might need talk therapy and to really get out emotions, and they do not need behavior therapy. So behavior therapy, again, is for people that need to change their behavior. Whether the behavior for adults, it might be smoking, it might be, some other behavior that is considered bad, but for children, it's usually some sort of behavioral thing. So yeah, that's what we use it for. And I'm going to go over just a few techniques and strategies that are used mostly with ABA. But they have something called chaining, and it's where you break down a task into smaller components. And so you do the simplest task first, and you teach that task. And once that task is learned, then you teach them another task, and you continue this until there's an entire sequence. So with the dog, the Pavlovian dog, remember the bell rang, it salivates, and it got hungry. So that was kind of a short chain. And with kids, it could be something much more elaborate. Like if you first you do this task, and then it leads to this task, you color this, and then you do this thing. Like I'm homeschooling right now, like most parents. And with my daughter every morning, I'm like, okay, you do this, your spelling stuff first, and then we do the math, then you can have a snack. And then I'll give you a cookie if you finish your lunch. Like that's not exactly chaining, but there are these like steps of something that a therapist would do to kind of get the kid to kind of play in order by these rules, and also they associate those things together, if that makes sense. And then prompting is when we want a specific desired response, so you prompt it. So that's also with the Pavlovian thing. It's like the bell ringing prompts the salivation, if that makes sense. So there's a verbal cue. So for instance, prompting my daughter's preschool, they do this thing like this, and it's called, and it basically means everyone be quiet. So the prompting that she does, and they also ring a bell sometimes, and that means everyone stop what they're doing and listen. And then they do this, and all the kids stop what they're doing, and that's prompting. That's prompting them to stop and then listen to what the teacher's saying. And shaping is when you actually shape behavior. So you do that with chaining and prompting, and you're basically gradually altering behavior to the point where it's closer and closer to the desired behavior. This can take a long time with kids, but it can be done. I don't want to say it can be done with any kid, but certainly ABA and other behavioral therapies are based on this idea that you can train a kid almost the way you train a dog. That sounds terrible, but it's kind of true what that sort of thing is about. There is an article posted on Canvas if you want to read more about behavioral therapy. The next lecture I do is going to be about cognitive behavioral therapy, which is a little bit different than a behavioral therapy, but this lecture is really just about straight up Pavlov Skinner, and I did ABA because I know some of you are either doing internships or interested. Thanks.